I was at a taping of Dr. Mark Hyman, and we were able to ask questions. And I asked the question, Dr. Hyman, can we reverse osteoporosis? And he said, yes. I said, wait a minute. Can I tell my community? Dr. Mark Hyman said osteoporosis is reversible. And he said, yes, I see it happen all the time.
Mm-hmm.
So you, Dr. Fishman, what would your answer be?
Definitely. I feel the same, perhaps for different reasons than Dr. Hyman, but I feel like I've seen it, more than I've probably seen it 10,000 times.
10,000 times. Reversing osteoporosis or reversing bone loss?
Reversing bone loss and osteoporosis.
Today's guest is Dr. Loren Fishman. He's the medical director of Manhattan Physical Medicine and Rehabilitation in New York City. He's the author of 12 books, including Yoga for Osteoporosis. He has written 100 peer-reviewed articles. He is world-recognized pioneer in the treatment of piriformis syndrome and rotator cuff tears, and an expert in curing back pain. He is the staff at Columbia College of Physicians and Surgeons and teaches at Columbia Medical School. He also has an ongoing study called 12 Poses versus Osteoporosis, and we'll learn more about that today in our discussion with Dr. Fishman. For you. My audience is women that have been diagnosed with osteoporosis or osteopenia. Many of them are looking for what can they do naturally in order to manage their bone health. And so I wanted to ask you, is it possible, if you're a woman and you've had a diagnosis of osteoporosis and you are maybe trying to avoid medications, some people do take medications, but some want to avoid medications. What is really possible for us women who are trying to do the best that we can with our bone health, from your perspective?
Well, yoga has proven itself. We did an 8-year, it ended up, we gave the disc to 1,000 people, and 741 of them responded, and of them about a third, 241, actually did the yoga at least 4 times a week. And if they did the yoga 4 times a week, then 83% of them actually gained bone. Some did better than others. Some gained a whole point. They went from 3.6 to 2.6 minus in their DEXA scans, from minus 2.7 to minus 1.7, where actual studies, this actually happened. Some didn't gain that much, but the vast majority, more than 4 out of 5, actually gained bone. So what did they have to do in order to gain the bone? Well, we gave them 12 poses. 12 yoga poses that we asked them to do for 30 seconds on each side. And we made a disc, a video, a little DVD that we sent to all of them. We just gave them away because it was a study. And we certainly first got blood tests to rule out metabolic, endocrine, or nutritional components. Was there calcium high enough? That would be nutritional. Was there thyroid hormone in the normal range? That's endocrine. And there were, we ruled those things out because while some claim that yoga does have effects there, I wasn't counting on that. I was just trying to measure the bone mineral density changes. And then we did one DEXA scan 2 years before we started the yoga. Many people already had this. Those that didn't had to get it and wait 2 years. So we had one from 2 years before they started the study and one DEXA when they started the study, so which showed us what direction they were going in the 2 years before they did yoga. Then we taught them the yoga, and 2 years later, we got another DEXA scan. So we could see whether the changes were significant, whether the yoga actually changed the course of their loss of bone mineral density. And it did.
Wow. Now, so can we use the words it reverses bone loss?
Yes.
We could actually say reverses bone loss.
Absolutely. Not only does it reverse bone loss, but it also stimulates greater bone growth when you're like 20 years old and you haven't had any bone loss yet. You're looking forward to it, but you haven't had any bone loss yet. So, the real time to start yoga is to control for the one thing we have no control over, which is our aging process. So, if you're 57 today, you're going to be 58 in a year. But if you start doing yoga when you're 14 or 16 or even 25, then your hormones are gushing through your veins and you're much more likely to gain bone faster. So that, let us say that your peak bone occurs when you're 40. Well, if you started doing yoga when you were 15 or 20, by the time you're 40, your peak is going to be a higher peak. It's not going to be like Pike's Peak. It's going to be more like Mount Everest. And so it'll take much longer for you to decline into the osteopenic or osteoporotic range.
Right. For
So,
those women, though, that are in the 60s or
right,
50s, right? And they're, because that's where most of us are, most of me and the women in
sure.
my community.
Uh,
So for those of us that are, and the women in your study, they were, do, were they menopausal females?
yeah, the average age was 68.3.
Right.
So they were older, yes. And I'm just saying this because some of the women that may be listening to this may find that they have osteoporosis in their families. And then their children or their grandchildren can avail themselves of yoga and never get into this problem in the first place. But no, our patients are older. We have patients in their 90s. And these are the ones I'm talking about. They have the hormones, the nutritional components, the genetics, all the things that you get when you're 90 or 80 or so on. The vast majority, I haven't calculated, but I'd say well more than 90% of the people in our study are over 65.
Wow. And they were the ladies that were able to get almost 1 point, which is a
So
very significant.
many of them only got zero point 0.3, but they've reversed it and they're going the right direction. And if I may say, that's what really matters, because if you take the drugs, you do gain bone, but you can only take them for a certain amount of time. And when you stop, you experience a precipitous decline in your bone mineral density. You don't go back to where you were when you started. 5 years hence, you're still ahead, but you're not as much ahead as you would have thought. And the big the big subject today is sequencing, how you go from taking one drug and then you come to the place where you can't go anymore with that drug. So you take another drug, then you come to its end stage, you take another drug. I mean, you're pretty well on them. If I don't want to say terribly negative things about the drugs, because they most of the time they do work, not always, but they very generally do work. But the yoga has such advantages over the drugs. What are the advantages? Well, it improves your posture. And not a lot of drugs will improve your posture. It improves your balance. Aren't very many drugs that will improve your balance. It makes you stronger. It makes you a better range of motion. It makes your coordination improved. And it lowers your anxiety. You may say, aha, got you there. There are drugs for anxiety, and there are, but they impair your balance. Now, the whole point of treating osteoporosis is to avoid a fracture. How do you get a fracture? Two ways, basically. You fall, or your posture is so crummy that you fracture a vertebra. Yoga improves your balance and improves your posture. In
Yeah.
addition to building your bone mineral density. Now, what are the other side effects of yoga? I think you should know. The other side effects of yoga are, there's an Italian study, it actually improves your vascular flexibility, which means fewer pulmonary emboli, fewer heart attacks, and fewer strokes.
Right. You shared a study with us, I believe it was
Yeah.
August of 2020, where they showed that I believe it was the hamstring that during stretching, not only did it stretch the muscle, it stretches the blood vessels.
It's something, not only, no, it's even more positive than that, Deborah, because not only does it stretch the blood vessels, which it does only in the leg that you stretch, but it turns out the vascular flexibility in the other leg is also raised. And the vascular flexibility in both arms is increased. So they
Wow.
they extrapolate, well, if it's true in an arm that is 2 feet away from where you're stretching, it's got to be something going through the blood. And if it's going through the blood, it probably affects your heart and your brain and the blood vessels therein. So it looks like it's really more positive than you would have thought.
Yeah, and there's a lot of people are looking for studies and evidence base, and I think that's what's coming out now. We're really finding that.
And that's an
So,
Italian study by, let's see if I can think of his name. De Benedetto. Wait, hold on. Let me do a little research right in the middle of this podcast, and I can't find it for you. I think I can.
Yeah, that's really fascinating. Well, we are a tensegrity unit. We're all connected. So we're talking about the physical body now. But then when we go
Mhm.
into yoga, we also then go into the mind body aspect and all the other
Well,
tremendous benefits.
that's one of the things I was going. When it comes to the simple measure of anxiety, that is true. The man's name is Visconti,
Visconti.
Bisconti. He's the A.V. Visconti. He's the chief, the first author. He's not probably not the principal investigator, but he's in there. Now, let's see. I can tell you another thing you do is you can reduce your weight doing yoga because the osteocytes in the legs, believe it or not, the osteocytes in your legs seem to govern your appetite. The amount of pressure on the osteocytes when you're walking around has a big effect on your appetite. And that's a study by, his last name is Jansen. It's a Swedish study, Johansson, I think.
Can I
Let's
just
see.
describe for the listeners that osteoclasts are the cleanup cells, right? They're the bone cleanup cells.
No, no, it's the osteocytes that do this. These are
Osteocytes. Okay, this is
that's
the
the ones that
osteocytes.
built. They're the ones that do this.
Wow.
It's John Olaf, Olav, uh, Janssen, Jan. I think it's Jann. No, Janssen.
And then you also shared a study that I found really profound when it comes to spinal health and when it comes to rotational forces on the vertebral bodies to create
Oh
bone
yeah,
building
that's
stimulation. And I think,
Italian again. That's Cristofolini.
yeah, that is the women that I work with. I work with women, and many women are coming to me these days with spinal wedge fractures.
Mhm.
And there's a lot of talk out there, a lot of questioning around rotation. Is rotation safe if you have osteoporosis? So I'd love
Well,
you to speak on that, on spinal health and rotation.
happy to. I mean, the American Osteoporosis Association, which has a new name now, strongly warns against twists. But I will tell you, there in the series that we tested for 8 years, well over 250,000 hours of people doing the yoga, more than 80% of whom have osteopenia or osteoporosis. I already told you the average age, 250,000 hours, zero fractures, not even one. Zero herniated discs, zero meniscal tears in the knees, zero rotator cuffs. It seems to be utterly safe.
Yeah,
And many,
I've taught your work since 2014 to thousands of women.
Mhm.
And it is because of you and your work and the fact that I believe it to be so safe. I myself had a hip injury at the time and I needed to learn more, and I was teaching at a hospital in Southern California to the, let's say, 55 plus crowd with
Mhm.
lots of musculoskeletal issues, and studying with you is what helped me build my body back up, but also to keep thousands of people safe over the years with what
Wonderful.
you've taught me as a yoga therapist. I mean, really, I use your work. I share this with my population. I use your name all the time with the women when I teach them about spinal rotation and posture and making sure that when to safely twist, you need to have length and a little extension in that thoracic curve. And I hear your voice when I'm sharing this work.
Oh, you
Uh,
poor thing.
no, no, really, because since 2014, I have women who have improved their DEXA scan scores,
Of
who
course.
have become bendable and not breakable.
Mhm.
So
Well,
they actually have falls, and they're so excited to tell me about this horrendous fall they had, and
uh-huh.
how unbelievably shocked they are that they did not fracture.
Well, that's right. I'm glad to hear you say that because it brings me to another part of this, which also is something yoga can be proud of, which is there are actually two parts to the bone. I guess no one's going to see this. I don't know. But the outside of the bone, the periphery, the circumference, the rim, that's where all the bone mineral density is. It all resides in those 2 or 3 millimeters going around the outside of the bone. But people have found in the last 20 years that the trabeculae, the crisscrossing, the reinforcements on the inside of the bone supply anywhere from 30 to 70% of the strength of the bone. And now people have looked at what happens with the bisphosphonates and what happens with some other medicines. And at least with the bisphosphonates, the outside of the bone does get better. The cortex, it's called, the periphery, the part that measures the bone mineral density. But the inside part gets weaker. So 30 to 70% of the strength of the bone is donated by something that's getting weaker on the medicines. Now, there's no question that the outside of the bone does contribute to the strength of the bone, but the inside contributes in many cases even more. Yoga does improve the outside of the bone, but it also, we have 37 patients now that we've sent for these scans where they measure the inside of the bone with the strongest MRI on earth. And it turns out yoga builds bone there too.
That's that Tesla, the
Yeah,
Tesla.
7 Tesla machine,
Yeah,
yes.
7 Tesla. I remember.
Nothing to do with Elon Musk. A Tesla is a measure of how strong the magnetism is.
Right. Yeah, that's really amazing. And maybe that's also partly why there's those spontaneous femoral fractures, right? Maybe
Yeah,
because with
well,
the
and that's
bisphosphonates or osteonecrosis of the jaw.
half the reason. The other part of the reason is that when they look at the outside of the bone of people who are taking the bisphosphonates, Fosamax, Boniva, these medicines, the outside of the bone actually has more micro cracks than a person who just has osteoporosis, and more micro cracks, of course, than a person who is normal. So it's a more recent study. I can give you the reference if you want.
Oh, I
I'll
love
look it
it
up.
for all the
What,
data-driven women. Because
what,
Dr. Fishman, that's what happens. Women go into their to have their DEXA scan and to speak to their physicians. And
mhm.
really, the only tool in the toolbox for the physicians are medications. And so that's the recommendation. And then the greater the number is on the DEXA scan, the more precarious or the more fragile the bones are getting, the more these office visits with the physicians are getting a little bit more, forceful. I mean, some women tell me their doctors are threatening them and telling them, okay, if you don't want to take
Yes,
these medications, you'll have a fracture within a year.
or they say if you're not going to take the medication, I won't be your doctor anymore. That's
Yeah.
another thing. They're so afraid of being sued. And there's some, I think most doctors are genuinely interested in the patient's welfare, and they believe in these medicines. This study I'm talking about, the main author is Kwek, Kwek,
Okay. I'll
and there are
definitely.
other people in it, Go, Ping Hao. There are other people in it too, but him and Lenart, Lenart, they're two uh, different studies that show this. And I've given them both to you now. They're both done in 2008, so it's 13 years ago. This is well known. One comes out of the European Foundation for Osteoporosis. The other one comes out of the National Osteoporosis Foundation of the US. So they're not fly-by-night studies either. So yoga is good at that too. You don't get micro cracks, and you do strengthen the inside of the bone. I mean, I think I've now exhausted the known benefits of yoga.
Well, that's important because people, and so what I always say is that to me, there's nothing in this world like yoga for osteoporosis, for bone health, for joint health, because we load the joints from so many different angles, and then we create that compressive and tensile force necessary to pull and push on the bones to demand more every single day, which is what creates that stimulation for the bones to remodel.
It's very well put, and that's been shown with turkey wings. A man named Everett Smith at Sheffield in England did a study. Here's what he did: he bound down one turkey wing, so they couldn't use that wing, and the other wing was free. And he measured the bone mineral density before he bound it down, and then maybe 6 months later. And the one with the very unusual tugs that turkeys' shoulders get when one wing is bound down produced more bone mineral density than just normal turkeys running around.
Well, yeah,
So
you could imagine they're trying to balance themselves, right? Their weight, and if they're trying to balance, just like someone on a tightrope that puts something out. They need both sides to balance. So if you take away that wing, the other wings have to flap harder. All
Doing an
that,
awful lot of
yeah,
extra flapping.
yeah, all
Exactly.
that connective tissue is pulling on the bone. So, yeah, and this is what is my mission, is to help women understand that there is so much that they can do. And I think there's this feeling of lack of control, and the physicians are in caught between a rock and a hard place because it's a metabolic condition, and the higher your numbers get, the greater the fracture risk is. So something has to be done, and if this is what their tools are in their toolbox, they're going to make those recommendations. I want to raise awareness to all the other things we can do to
This is
support our bone
to
health.
me, yoga is like the perfect thing because, as you say, it's good for the joints too. Whereas the other kinds of exercise that people recommend, bouncing up and down, running, all weightlifting, all these things are not good for the joints at all. Whereas yoga, whatever else yoga does, it stretches and it improves your range of motion. That's the joints.
Yeah, and it's a
It's
practice of self-care.
older people are caught between osteoporosis and osteoarthritis. For the osteoarthritis, oh, don't do anything that's too strenuous. For osteoporosis, do impact exercise, which is bad for the joints, so it's good for the bones. But what if you don't do any? What if you just do very gentle things? Well, that's good for the joints, but bad for the bones. So the rock and the hard place, here it's a rock and a soft place, but it's the same idea. And that's where yoga does both without injury either.
Yeah, and
So
I said my teacher in India, he taught us about arthritic deposits in the spine and how when we do a lot of the movement, we're actually dislodging. So, when there's the adhesions that begin or arthritic deposits to begin, I like to say that at first we get sticky and there's arthritic deposits, which is really the bones dissolving to release minerals to lay down more surface area, especially for joint malalignment. And if we're able to move it, we could become, if you don't move it, you get stuck. So let's not get stuck. Let's move the stickiness back into the system to be metabolized, to be picked back up by the bones, and keep ourselves fluid and
well,
mobile forever.
the fluid that's in the joints is not that different from, I mean, it's different, but it's not that different from amniotic fluid. And just as an embryo forms inside the amniotic fluid, it's not the embryo, but it is real calcification that occurs into the sinew of the joint. The sinews that cross in, like in the shoulder, the long head of the biceps, goes into the joint. And it can get calcified without any trouble if you don't move it a lot. Sometimes it gets calcified anyway, but it's certainly when it's you're in that
Yeah.
terrible position, not moving your arm.
And
And
calcified means calcium, right? Which is
yeah,
99% stored in the bones, which means the bones have dissolved to release the calcium into the system to go to the area of need for repair.
well, I don't quite see it exactly that way. I see it as a
No?
calcium bloodstream that gets drawn in because of the metabolic condition right there, the local condition in the joint. But I understand what you're saying. Also, there's adhesive capsulitis for frozen shoulder. Without the advantage of any calcium getting deposited, you find you can't move your shoulder because the capsule itself that holds that fluid in there gets tight, and you simply can't lift your shoulder. And the cure for that exists, but it's really painful. So you don't want to go there. So movement, action, this was known long ago. There was an Arabic man named Al-Kindi who had memorized the Quran when he was 7, and he knew math and he played musical instruments. A brilliant guy. And he said at one point something that Galileo said 1,000 years later. He said, a fervent believer in God, he said, why did God give us eyes if not to see? Why did God give us limbs if not to move?
So true. It's a use it or lose it proposition.
Lose it or and abuse it and lose it too. You could do that. You brought something up, and so I thought of one last virtue of yoga that I kind of alluded to but didn't really address, which is yoga you can do your whole life. You don't have to stop doing yoga after 3 years or 7 years or something like that. So if you're gaining a little bone, then in 10 years, you will have gained 10 times more. When you look at the graphs from, for example, the bisphosphonates, at first you have a very steep climb in your bone mineral density, But after 3 years, you're almost just holding your own. You have a very slight increase. And when you project the yoga improvement for 3 years, which I must say is a projection, we've only really studied for 2 years, but it does not slow down the way it slows down with the medicines. So yoga keeps on giving you that same improvement year after year, so far as we know at this point.
Yeah, and Dr. Fishman, I had a hip replacement when I was 51. So I had a hip replacement, and I went from being a very strong practitioner, and I had an injury in my hip and a scope, an arthroscopic repair that collapsed my hip joint. So I really went into a place of complete hip joint collapse, dysfunction. So I went almost back to beginner body. What I noticed is even though I lost a lot, I had those years off of being able to really practice at a pretty high level, I still had so much memory of yoga in my body. So that when I started to practice again after my hip replacement, it was so quick that I gained back my range of motion, my flexibility, my strength, and my balance. And I
You
really
want me?
think it was the years before.
It was. You want me to tell you a wonderful story of Mr. Iyengar? It just happened in India. They're like a group of 25 of us, from Spain and South Africa and Singapore that hung out with Mr. Iyengar. It's not like what the expats are today, but it was a group. And one day, a young woman from South Africa, a dancer, maybe 21, came in crying. And what's wrong? She said, I broke my leg. My dancing career is over. I'm finished. And Father Lobo, who was rather a stout man, he was a Jesuit from Spain, and he was a good yoga teacher, not so terrific a yoga practitioner, but a wonderful teacher, came over to her and he said, listen to me. How many hours a day do you practice your dance? She said, 5. He said, well, you can't do the dance now, but I want you to spend 5 hours a day going over in your mind what you do. You feel the wind on your cheek as you do a pirouette. The hair goes, he described it to her in terms so she could really understand what he was asking her to do. Long story short, about 10 months later, she came into the class one day, ebullient, just shining, radiant. She smiling like nobody's business, like a Halloween jack-o'-lantern. What is this? She said, my cast is off. They said, oh, that's wonderful. That's great. When will you start dancing? And she said, I'm going to cry. She said, oh, I've started back. And you know what? I'm better. I'm better than I was before I broke my leg.
Wow. Yeah,
A lot of it is mental.
yeah, well, there's the mental emotional layer, right? And there's actually there's studies on psychological stress and how it affects bone loss. Okay, so can we talk about the spine? Because that is where half of all the fractures are in osteoporosis. I'd love to raise awareness to ladies. This is probably the biggest aha that I share with them. So let's talk about the spine, and 50% of the fractures are in the spine. Can you describe where they are in your experience, all these years of experience that you've had? Where are those fractures and what are the contributing factors and what can we do to avoid
What
them?
can we do about it? All right. Well, first, where are they? I have a vertebrae here. That's probably from a giraffe. It's as big as I am, but here it is. All the fractures I've ever seen in almost 50 years, almost half a century of practice, are right here. All the osteoporotic fractures, except if you fall back and hit this little bone, the spine in the back. That's a fall, very unusual for this. Usually people don't fall on the back. All the other osteoporotic fractures, without exception, are right here in the front. And I've seen thousands, right at the front of the vertebral body. That's where they are. What makes them happen? Well, posture is a large contributor because as you bend forward, more weight goes onto the front of the vertebra until that weight is greater than what the vertebral body can sustain. And then you have a fracture. Mirshid Sinaki at the Mayo Clinic did a study many years ago, and she had to stop the study. It was a study of what's better for the spine, bending backward or bending forward. Bending forward caused so many fractures that she stopped the study in the middle and said, we've come to a conclusion here and we don't want to hurt anybody else. And it's been replicated, and it's true. So you can't do that to strengthen it. You can't just put weight on it. Now, what we have found, and what is verified in a study by Cristoffolini that I mentioned before, an Italian study, they took a vertebrate. It's like a Frankensteinian type of experiment. They took cadaveric vertebrae. They took out of dead people, and then they put a little pressure sensors at various points around the vertebra. And then they submerged them and solidified them in concrete. And you should see all the wires coming out of these with all the sensors and everything. And then they subjected the vertebrae to different pressures, straight down, 15 degrees from the right, from the left, from the front, from the back. And then they did this wonderful thing. They twisted them to the right and the left, just what the NOF says you should never do. And what they found was that the pressures went up greatly when they pressed from the front. Oh my goodness, that was the kind of pressure that would break a vertebra. Well, that's not really news, because that's what we saw with Mircea Tsenaki's study, and what you see in these 1.5 million fractures a year in the United States that are due to the front of the vertebra. That's where they occur. But you know what else they found? That when you twist the vertebrae, you put more pressure, but not a breaking amount of pressure, on the front of the vertebra, the very place where all the fractures occur. So what I recommended and found to be true in the studies I did was front of the vertebra can be strengthened through the twisting poses. So I recommend Marishyasana, Matsyendrasana, the twisted triangle, you know, the reverse triangle. Those are some. Parivrita Parsvakonasana is good, but that's a difficult pose. And it works. I mean, we've shown it.
And then the important things to keep note when they are twisting is length, and maybe actually adding some back bends, some spinal extension to the thoracic.
Afterwards. Now, the one, well, who can't do this? People that have a scoliosis curve of more than 45 degrees shouldn't do it, because the spine is curved and it acts kind of like a crank that can twist your spine too forcibly. So you shouldn't do that. By the way, for your people, I would like to say to them that we have a study that we're doing now on teenagers, 14 to 18 years of age, in which we're giving them yoga to strengthen the weak side and small botulinum toxin injections to temporarily weaken the strong side. And we're seeing fabulous results. I wish I could show you an X-ray of someone who had like a 20-degree curve in June and has a 0 curve in November. Wow. It just works very well, and it seems to last.
Well, and you yourself did a study, right? You held a posture for, was it 8 minutes in an MRI Vasisthasana, side plank?
Yeah, it was for spondylolisthesis. And I got a couple other crazy yogis to do it too. Yes. We had a patient from New Jersey who was a chiropractor, and I cured him. Whatever was wrong with it, I don't even remember. And then he was grateful, and he said, you know, I'm a manager of an MRI facility. Would you like to come down? My ears went straight up. It's a wonderful thing to do. We did Paschimottanasana long enough for him to do an MRI of us. You know, we did a couple of poses to see, well, what's going on. And we found out a lot.
I'm gonna have to include in the show notes a glossary here with all the postures you've shared today and what they look like for people.
A very good idea.
You give a lot of hope, and that's what has happened for me since 2014. And I got certified with you in Chicago in 2017 to teach yoga for osteoporosis.
And right. Well, I want to distinguish between hope, the big leap from hope to faith. You know, we can have some faith. There's real data out there now. It's going from excitement to data. There is a lot to solidly recommend this at this point. It ain't just conjecture and wishing and hoping. You know, you can.
Gosh, music to my ears, Dr. Fishman. And I would love to interview you again on the data that you shared with us in June of 2022 on the studies done with sarcopenia, osteopenia, sarco-osteopenia, the new term, and then the brain and the muscles, and that was like
so interesting. What they call it, bone muscle crosstalk. And there's even a new drug that is already interrupting that crosstalk by glomming onto one prominent member of the vocabulary that the bones and muscles share. And it seems to be the best one out there at this point. If you need it, most people, I don't even know anybody that really needs it, but I suppose there are people on whom the yoga doesn't work, and they might try the medicines.
Okay, when
But
you
to me,
say you
yoga,
don't when you say you don't know anyone who really needs it, you mean needs this new drug or needs any medication?
yes, needs any medication. Yeah.
Wow.
I don't see it, but our study was only good for 83% of the people. Some of them probably told us what they thought we wanted to hear. I'm doing it 4 times a week, but they probably weren't. Others probably didn't get better for other reasons, not nutritional, not because their bloods or anything else is wrong. It's just they didn't happen to get better. One can't claim to know everything. And for those people, the medicines might be of use. There's some on whom the medicine doesn't work, some on whom the yoga doesn't seem to work, about 17%. Now, for those people, one might recommend a medicine. If so, the best one out there right now is called Evenity, Evenity. I think it's quite expensive, and usually you have to try another medicine before Medicare will pay for it because it's so expensive. But it does seem to build both the outside of the bone and the inside of the bone. But there are side effects, cardio, heart attacks, strokes. Not a perfect. None of them. They're
And you
all
might
poison.
ruin your kidneys and liver.
You might ruin your kidneys, certainly.
And
Yeah.
who else knows what's going to happen? And like you said, then you need to go from one to the other. And what I've noticed in listening to some of the discussions on medications is that there's usually a window where they start to notice kidney involvement at a certain level that's considered not acceptable anymore. So we
Right.
don't, there's a something's happening metabolically when we're using these
Yes.
medications. And then we get to a point where we need to say, okay, what's next?
The bisphosphonates, they say 5 years is a maximum now. For teriparatide, Prolia, which is another pretty good one, if you're on it, 2 years is the maximum. For some of them, like this new one, Evenity, studies only go 1 year.
Yeah, because it's only a new drug, right?
I always think of the CEO saying, well, this year we're going to make a lot of money. The stock will go up. But what about the poor people that are taking this medicine? They're not thinking that way. But the drug, I mean, I don't want to badmouth the drug, and think of what they did with COVID. Think of
Yeah.
the spectacular work they did.
Yeah, I mean, medications have their place. I
They
think
really
that,
do.
osteoporosis it's a lifestyle disease. It's a metabolic disease like diabetes and heart disease. And we were reversing them and focusing our awareness on being able to reverse them. We can also reverse, well, I use the word reverse, and I've been told I need to be careful with that talk, but I say either slow down, stop, and or reverse bone
This
loss.
this slows it down, stops it, and reverses it in almost every case. More than 4 out of 5.
I was at a taping of Dr. Mark Hyman, and we were able to ask questions. And I asked the question, Dr. Hyman, can we reverse osteoporosis? And he said, yes. I said, wait a minute. Can I tell my community? Dr. Mark Hyman said osteoporosis is reversible. And he said, yes, I see it happen all the time.
Mhm.
So,
I'm not.
you, Dr. Fishman, what would your answer be?
Definitely. I feel the same, perhaps for different reasons than Dr. Hyman, but I feel I've seen it, more than I've probably seen it 10,000 times. This
10,000 times reversing osteoporosis or reversing bone loss?
reversing bone loss and osteoporosis. Both. I mean, enough bone, no, making them go from osteoporosis to osteopenia to normal, all the way down the scale to normal.
Yeah, I guess that depends where they start. I remember once you told us that you were working with a woman that was in the negative 4 point something category, and
Minus,
what was it?
go ahead. No,
No,
the worst. No, go ahead. Go ahead,
no,
Debbie.
no, you tell me. I don't, she's your patient. So what was her number? What did you do with her? And where did you get her to?
Woman from Tasmania in the coral, other side of the Coral Sea. She had minus 5.7. I've seen them with 4.7 and 4.2. I've seen them, many, many. And she didn't do anything but yoga. She didn't take any medicines. All her other blood values were normal. And she went down. I don't really know how far she's down by now. My guess, that was about 8 years ago. My guess is she stopped communicating with me. She went down, 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 and now she's probably osteopenia or normal.
Wow.
But she definitely got better doing the yoga. Another one was 4.7 and now is 1.2.
4.7 to 1.2 with no medications,
that's
with
a negative
yoga.
4.7, negative 1.2.
Yeah, sorry, -4.7 to -1.2. And it was yoga.
Just yoga. Because
Yeah.
the cells that make bone are responsive to the pressure that you put upon them. And gravity, weight bearing has some pressure on your bone, but yoga has much more pressure on your bone than just gravity. It's probably 10, 20 times greater. I have not measured it, but think about it. When you raise your arm, you're opposing gravity. So clearly our muscles are stronger than gravity. But also in yoga, you have one group of muscles opposing another group of muscles, both of them trying quite hard. So you're probably 10 or 20 times greater pressure, and the leverages are maximal. You're holding onto your ankle and moving your whole leg like a crank, like what are they called? Like a crowbar. You're putting the crowbar kind of pressure on the neck of your femur, which is the most dangerous fracture. That's the one people die from. Not the most common, but clearly the worst.
Yeah,
So
crowbar
yoga,
pressure in a safe manner.
as you can tell, I'm pretty pro yoga.
I can really tell. So this is what I always say: ask and you shall receive. If you ask all day, every day for more bone, your body will give it to you. More bone, more balance, more flexibility, more range of motion. And so on that note, so for those that are not going to be able to do 12 poses all the time, right? They maybe don't have the time or anything. Do you see that we're able to be effective if, let's say, every day we think of our lifestyle as yoga, where we brush our teeth on one foot, or, do tree posture, brushing your teeth or washing your dishes. When we wait for our tea to boil, we come into chair posture, or we go onto the ground and do plank and come into side plank. Do you feel that I mean, I know it hasn't been studied, so this is just a matter of what are your thoughts on this, of a lifestyle?
The lifestyle, what you're describing is probably not only good for your bone mineral density, it's probably good for your demeanor and your attitude towards your life to do that, to interrupt it every now and then. And I have some postures that intimate the great beyond. It's true, but right now we're studying which poses do what, because it may be that 2 or 3 poses are all that are really effective and the rest are just draws. They're not helpful. We don't know. That's what we just have a study. Unfortunately, we just closed it 2 days ago. We have enough patients in it, but we will come out with information with any luck about which pose builds which bone. So we hope we'll be able to say, oh, you have trouble with your spine? Do this pose, and this pose. And that's all you need to do. By the way, the 12 poses take 12 minutes to do. 30 seconds on each side. That's a minute for each pose, 12 poses. You do the math. 12 minutes. It's not a great big hunk of your day.
Yeah, I think,
but
go ahead.
If you really want to be good at it, you don't do it for 30 seconds, you do it for 50 seconds. So you still haven't gotten beyond 20 minutes.
Yeah, so
But
what I
20
think
minutes.
I'll create a practice after this. I'll create a practice that is the 12. I do teach your work. I teach 2 classes a week. I've been teaching since 2014. And I have YouTube videos on your practice. It's an hour because I do a lot of warm up. But I'm going to actually create a practice after this that is the 12 postures, one after the other, which is usually not the way I teach it or practice it myself. But I will do that and see what my time is. I think the quickest, when I have tried that before, it's been about 15 minutes, moving from one to the other.
Not so bad. We've these that you could get on my website, sciatica.org. You go to the store or to where it says osteoporosis, and my video is free. You just can go on and look at the 12 minutes, or you can You can buy, we have a download, you can sort of rent it for a year and look at it streaming, or you can buy a little DVD for the first, second, or third series. If you're interested in that.
Yeah,
And
definitely.
I'm sure that your sequence is going to be very interesting and wonderful too.
Well, the more the merrier. And the more that everybody teaches something different, there's guidance in a way that helps people find in their body that posture in the deepest, safest, and most effective way.
And I'm coming out with a second, with W.W. Norton. We're doing a second edition of Yoga for Osteoporosis with all these things about, it's not out yet, won't be out for a year probably. Yeah, that's the first edition. Second edition, it will have a lot about bone muscle crosstalk, and all three of these series that we do described in gruesome detail.
Oh, I
So
can't wait. Yeah, there was a recent study that came out that shows that even 2 minutes of walking a day is beneficial for health. It was a study that came out that I
yeah.
saw recently.
And another one that came out of Harvard, out of the University of London a couple of days ago, was that what kind of exercise is best for cognition, to maintain your cognitive abilities as you age? Answer: vigorous exercise. So yoga, not done while you're making tea, but yoga done, in a serious way for 20, 30 minutes a day will preserve your intellect more than anything else we know of today.
Yeah, it's the answer. Yoga is the answer to everything. I mean, to mental, emotional health. But for me, when we're talking about bone health, it's the answer.
One good answer anyway, that's for
Yeah.
sure.
Okay.
I better go. I have a patient staring moodily out.
Okay, Dr. Fishman, thank you so much. This was so wonderful. I'll share the episode when I have it all edited. I would love to interview you again on any topic of choice, and I'll reach out to you.
I'd love to talk about scoliosis because I'm doing this study and I would like to drum up more patients for it. So anytime.
Okay, yeah, I've got some ladies I work with that are in your study currently, that are in the 2-year study, that are, I work with them every few weeks. So actually, I'll reach out to you and we'll set up a scoliosis discussion.
The study is absolutely free. In fact, we pay for the x-rays, but it's a grant. So anytime. Good.
Okay. All right. Thank you so much. Have a wonderful day. Thank you for speaking to us.
Bye.
Bye. Thank you so much for listening to Stronger Bones Lifestyle Podcast. Bone loss is not an inevitable part of aging. We don't have to just wait for it to happen. There is so much that you can do, and that is what you will learn each week on the show. Go to my website, DebbieRobinson.com, if you want more information about what was shared in today's episode. At the bottom of this episode in the show notes, there will be links to whatever was shared. Please subscribe to this podcast. Share this podcast with your friends, your family, or any women that you think may be interested or benefit from the information we're sharing. Please rate the podcast. And if you have any questions you'd like asked or answered, I would love to hear from you. Let's do this, ladies. Let's change the way the world views osteoporosis and slow down, stop, or reverse our bone loss, take charge, and show other ladies what is possible. Thank you so much for joining me.